You're suffering from knee pain and really want to know what you can do about it, what you can do yourself. There's a secret you absolutely need to know, but wait, there's still more. Watch all the way to the very end to learn essential ways to care for your knee, keeping it healthy and strong throughout your life. That sounds good, doesn't it? Even though it completely contradicts what we commonly believe, because everyone thinks the older we get, the more we've walked, the more we've used it, like with a car, where a mileage counter is installed, the more it's used, the more the menisci wear out, and the same, the cartilage, it wears out more and more. And eventually a new tire always needs to be installed. And then it's time to say now an artificial joint needs to be installed. We see that very, very differently. And to help you understand this, I'll first explain the anatomy of the knee. Let's take a closer look at the knee joint. As you can see, we have the thigh, the lower leg, and of course the knee itself as the connecting element. It can be stretched out and it can also be bent. At this point, the joint reaches its limit, just like with most individuals, by the way, and we'll discuss that further on a bit later. But in general, you should usually be able to comfortably bring your heel all the way up to your buttocks. You can bend and straighten. When the knee is bent, you can even rotate it a bit, but that movement isn't too significant for our explanation now. How is the knee held together? There's a capsule around it, and this capsule ensures that everything stays nicely together. However, we also have ligaments. There are ligaments on the outside and the inside, and we also have the cruciate ligaments. You've probably heard the name before because they often get injured while skiing and then need surgery and so on and so forth. However, at this point, there are muscles, since the muscles are genuinely the only engines, so to speak, with which you can move the knee, with which you can walk, perform a squat, and all these other related activities. And the muscle responsible for extending the knee joint is referred to as the quadriceps. It is called this way because it is composed of 4 distinct parts. 3 of its parts originate here, and then a central part runs over the kneecap to the tibial tuberosity. This is this part here. One segment stretches a bit more outward over it, and another part goes a bit more inward over it. Additionally, there is a 4th segment that reaches beyond the hip joint, stretching all the way from there to the pelvis area, covering an extensive area. These are the main extensor muscles responsible for the movement in the knee. When the knee naturally bends and this important muscle group contracts, it actively pulls the joint into place until it gradually becomes fully straightened. And on the back side, there are the flexor muscles. These flexors originate from way back here and they extend down along the entire backside. That's that solid bundle of muscles you feel when you touch the back of your leg. And they stretch across the knee joint, extending down to this exact point. When these muscles are activated, which means when they contract and pull together, the leg is lifted upwards. So this is the lower leg that is being pulled up, causing the knee to bend. There is also a 3rd muscle group in here, which is the calf muscle, the larger one. It originates down here from the heel, runs through the Achilles tendon, and then a part of it, consisting of an outer and an inner head, attaches to the lateral epicondyle and the other to the medial epicondyle. And it also contributes to flexion. However, its main function is enabling us to stand on our tiptoes. So with that, we finished discussing the muscles. Essentially, these are the engines that set the entire system into motion. But when looking closely, people often visualize a joint as a perfect half shell with the head neatly inside, everything aligned as a clockwork mechanism. However, the knee's structure is actually quite different from such a typical expectation. You see, this section is nearly flat. We have the condyles, those rounded areas, but underneath there's no well-shaped socket for them to fit. Instead, it's almost a flat surface, differing from the typical joint structure. The cartilage and the menisci are situated there and on the opposite side. You'll also find the cartilage and kneecap, which I forgot to mention earlier. It plays an important and crucial role in effectively transmitting and distributing these forces. All these muscles run here, come in from above, and then transfer the movement. And the kneecap is the point where, for example, when we kneel on it. So it's supported and connected from the front again. Now it's about, you've probably heard before, there's osteoarthritis, which means the cartilage breaks down, and the menisci, they tear and don't function as well as they previously did. Everything inside here within the knee joint space essentially requires proper nourishment. And these parts receive their essential and vital nourishment thanks to the fact that during movement under a given amount of load, the cartilage is effectively and sufficiently compressed. Then the waste products are effectively transported outwards. And when the movement releases this area again, it expands and draws in nutrients and fluids from the surrounding environment. That is the synovial fluid present in the knee joint. The cartilage absorbs the essential nutrients, which are the proteins, back into its structure. And so it nourishes itself not by blood, but through diffusion, like a sponge. There's something quite unique and special about the knee joint that you don't typically find in all other joints. Due to the fact that a relatively large angle needs to be bridged in this area and the bearing surfaces are quite small, the knee joint indeed possesses the intriguing ability to roll. Rolling implies it's a particular kind of movement. However, it can also slide, similar to how slipping works. And there is a rolling and gliding movement involved. For this to occur perfectly, ensuring that the cartilage and the menisci are not excessively stressed, but instead utilized just as nature has biologically designed it to be, the muscles responsible for controlling everything need to be well trained to ensure that these forces within the joint do not cause any part to be overstrained, but instead guarantee that it is strained as minimally as possible. And as always, wherever there's movement and surfaces rub up against each other, there's inevitably some degree of wear and tear. And that's completely normal, part of the body's natural processes. The body has its ways to repair damage. Stem cells activate when wear occurs, diligently working to rebuild and restore everything to its original condition. What has been damaged there, important in this context, is that the tensions at play here, the forces being transmitted, that they are within the physiological range, meaning within the biologically normal range, so that everything functions well because we are planning for a lifetime. Now we need to closely examine how we use our knee. How do we move it daily? Let's see. And when you take a moment to think about it, like what I'm engaging in right now, I'm actually standing. In the very moment we find ourselves standing, let's attentively consider the quadriceps muscle, which is this large and powerful knee extender stretching all the way from the front here up to the top here on our legs. What length state is it when you're standing upright? Well, it's in a shortened state. It will become longer or more extended if you bend the knee. Nevertheless, in this particular state, it remains quite short. Okay, and now we need to bear the following point in mind. We are not just any structure, but a complex biological entity, a living structure composed of cells. Our body constantly adapts and changes in response to how we train it. So every time we stand, we're effectively training this muscle to stay in a shortened state, reinforcing that pattern. And if we stand often, it's a form of training that occurs frequently, where this muscle repeatedly learns, I should maintain a shorter length. And it will more readily adapt to this position, as illustrated in this specific example, than it would to a longer position. Now, the running element comes into play. When you're running, there's this motion that kind of goes like this. And you notice it's still quite short. It does change a little, but not very significantly. Even in that situation, it will likely learn to keep things brief. So what else do we engage in? Standing, walking, sitting. Let's take a closer look at sitting. When it is sitting, it's noticeably longer, but still unburdened without truly getting trained or conditioned. It is simply stretched a little longer in a passive way. But what about the flexor muscles? The flexors, which originate from back here, they are indeed extended here. However, this implies that when you are sitting down, the flexor muscles are in a shortened state. Consequently, when you're standing and walking, the extensor muscles are shortened, and likewise, the flexor muscles remain shortened here. And now there's another muscle group being added, which I mentioned earlier, namely the large calf muscle. The large calf muscle, interestingly enough, remains shortened when seated, although it's naturally longer here if you closely focus. You'll notice it's kept in a shortened state at this spot right here. What other functions might the knee joint perform? For instance, you could lift the leg, keeping it straight with your foot flexed, and keep raising it higher and higher all the time. If you've ever tried that before, you'll find it's really quite challenging. It pulls noticeably at the back and you really can't do it very well. The higher you lift the leg, the less well it tends to work, and the opposite is true. That you move the leg backward and even lift up with the heel, keeping in mind that it offers its own set of challenges and benefits. Perhaps even further than I can show now because there is currently a restriction in place. In that particular position, you could also easily manage to bring your heel all the way up to your buttocks. You can even observe that from time to time with joggers and runners who every now and then make those rather peculiar or unusual steps, letting the heel gently and effortlessly make soft contact with the buttocks every so often during their running. They realize that running is inherently one-sided and can lead to muscle shortening. By regularly adding this exercise to their routine, they effectively regain essential front length, aiding balance and enhancing running efficiency overall. Typically, runners don't lift their leg forward with each and every step, but doing so regularly would certainly be beneficial in aiding to their flexibility over time. Or even sitting on the floor. Sitting on the floor with the legs positioned like this has become nearly impossible for most individuals because it creates such a strong pull here at the back that they are forced to lean or fall backward. And they might need to grasp onto their leg tightly in order to move forward so that this shortening effect does not cause them to be pulled backward. And what could be another movement that one might do? One might choose to go down into a deep squat position. That would approximately look something like this. The issue we encounter nowadays is that we no longer carry out these kinds of movements in their entirety, as I have illustrated with certain examples. We no longer complete our movements thoroughly anymore. As a result, we lose certain angles that would normally ensure that what gets shortened during activities like standing, walking, and sitting experiences a lengthening or stretching effect. And if we continue living this way, primarily just standing, walking, and sitting all the time, then it's generally fine for a few years. So younger individuals, young adults, typically up to about 30, 35, or even 40 years old, usually tend to have fewer issues with their joints, including the knees. And then as you approach the age of 50 or 60, it accumulates more and more. And everyone tends to think it definitely has something to do with getting older. And I am of the opinion that it strongly relates to the fact that we have maintained shortening positions for extended periods without taking action to balance them out again in any way. Because if you position someone who is 50 years of age on their stomach, just as a playful experiment and then bend their knee, take a really close look at how near it gets to their buttocks. For most people, it stops at a 90-degree angle here, or it gets really tight and they're already saying, oh, that hurts, that stretches. Everything is too short. Now take someone who doesn't practice this regularly and challenge them to attempt touching the floor with their fingertips as they bend over. Most people struggle with that too and are glad if they can come down past the knee. With the groundwork laid, we're now able to explore where exactly the pain comes from. To lay a solid groundwork once more, what proactive steps can we take in advance to prevent pain, or how might we effectively remove it once it becomes present? We often say pain is something positive, but why is that? Well, consider this. If this muscle is experiencing an excessive amount of tension, pulling excessively, then the lower leg gets pulled upwards. Within the knee joint, the menisci and cartilage structure are subjected to even greater compression than before. If at the same time both the bend and the calf are too short, it results in the lower leg being pulled upwards once more. Consequently, the pressure within this area is significantly increased further, adding extra strain. And now try to imagine what happens in such a situation. You have a bone pressing against another bone, and they begin to move against each other. If they move freely against each other, there's a little bit of wear and tear. That's the physiological situation. However, if there's significant pressure behind it and it's continuously moved under such pressure, then it stands to reason that more wear and tear will certainly occur. And that's precisely what occurs in this situation. Now we have to differentiate because on one hand, there's increased wear and tear, which eventually reaches a point where it can no longer be repaired. That means the osteoarthritis will continue to worsen, the cartilage will keep deteriorating, the menisci will be compressed too much, they tear and they detach from the surface. All of that can indeed happen. Moreover, at the same time, we emphasize that the body continuously measures and monitors all these ongoing processes. It measures the tension, it measures the force of the movement, it measures the pressure all through the pathways of the brain. And now let's say all of this detailed information is gathered and channeled into the central computer, which then calculates a degree of risk to both the cartilage and the meniscus so substantial that it concludes any repair is simply impossible. And that is considered to be life-threatening. Therefore, as a natural response, the brain sends out a pain signal to alert the body. Somewhere around the knee, exactly at the point where any movement that could potentially worsen the current situation even further needs to be prevented. And there we completely agree with the most advanced pain research, because pain always arises in the brain. And when the brain sends this sensation of pain to the area around the knee, it does so specifically to prevent exactly this kind of movement that would continue to cause or even exacerbate the wear and tear. To stop that. Then that's indeed the language of the body, a clear and significant statement, as the body is communicating directly with us and letting us know, and therefore we won't perform this movement because we're paying close attention to it. This leads to us moving the knee even less than what we were already doing before. Just keep in mind, we're already restricted in our movement, and the pain causes us to reduce our activity even further. What happens now with the nutrition of the cartilage? We had said we need full movement under load, under normal load, repeatedly into all angles. That will now be even further restricted. This means, in essence, there's essentially a double trap situation unfolding. On one hand, the forces involved are extremely significant, meaning that the wear and tear, the mechanical abrasion turn out to be larger and more significant than what is biologically intended in the natural design. And simultaneously, certain parts, certain areas of the cartilage essentially experience starvation because there's no more loading or unloading happening in those regions, where waste materials can't be properly expelled and fresh nutrients can't effectively enter the system. That means it wears down and the cartilage starts to starve. However, now it becomes very intriguing and also not straightforward to understand. We need to carefully consider the pain on one hand, and on the other, understand what happens to the cartilage and menisci within the knee joint, particularly focusing on the gradual wear and tear affecting these important structures. And now comes the revealing secret, which is that in the majority of cases, they actually have nothing whatsoever to do with each other. This is a process that runs in parallel. And reality shows this as well, because there are people who experience the most severe kind of knee pain. They can hardly move, they can't bend their joints, they've got a real problem. Then they consult with a doctor and undergo an MRI, CT scan, X-ray, or whatever other type of diagnostic imaging procedure. But nothing is found. The menisci are fine, the cartilage is fine, everything is in perfect order. But they experience very, very intense pain. And of course, there are also the cases where there's knee pain and also wear and tear, osteoarthritis, or a meniscus injury is diagnosed. However, there is also a third case that occurs repeatedly. There are even studies on this showing that worn cartilage arthritis can be present, but the person is completely unaware of it. There are certain specific studies conducted to uncover these findings. Alternatively, there are cases of accidental discoveries that reveal while there is no felt pain, there is in fact significant osteoarthritis and the menisci are damaged. This serves as a strong indication that what I explained earlier is indeed correct and true. And we encounter it every day with patients who are experiencing pain, some of whom have also received specific diagnoses of meniscus damage, of osteoarthritis in the first, second, third stages, and we've even encountered cases in the fourth stage. And we treat them, do exercises with them, or relax their muscles through our osteopressure, this pressure point method, and the pain is gone. Completely independent of what's structurally happening in the knee. What does that mean for you now? If you suffer from knee pain, make sure to focus on exercises specifically meant to relax and ease up the muscles we've discussed earlier. You'll swiftly notice a substantial difference. It's really quite astonishing that, generally speaking, once you've engaged in this specific exercise directly afterwards, you'll realize there's absolutely no necessity to continue repeating it multiple times. You do it once and usually notice right after the first exercise. It has already changed quite a bit. That's significantly less. And that's when you realize you're heading in the right direction. It's these very specific exercises that have been uniquely designed to help normalize those shortened and tense muscles again. And you can find all of them right here.